Good afternoon.
Good afternoon. How's everybody doing?
We're back.
Yes.
Your favorite tag team, Amanda Hines.
Christina Guerrero.
And we are continuing with our series on OCD, or Obsessive Compulsive Disorder. Last time we talked about what obsessive compulsive disorder is, and basically it's pervasive, ever-present thoughts, and they compel you to do things that are above normal. And so today we're going to delve deeper and talk about the ways in which it affects women differently. And I will touch on some treatments. And next time we meet, we will talk further about the ways that OCD affects men. And we'll get into the specifics of treatments and also talk about alternative treatments.
Okay, hi. I'm going to touch a little bit about OCD today in women. And later on, we will talk about men. But women's are 1.6 times more likely to get OCD than men. In general, men with OCDs are more likely to develop OCD within, they are more developed, men develop OCDs within the adolescent, the young age, and women usually develop OCD within the adolescent years. Women's OCD tends to have significant or more depression and anxiety than other people. Women are more likely to have obsessions that center around themes like contamination and cleaning. If you notice a woman with OCD, we are constantly cleaning. Everything has to be in place. Everything has to be in order. Because of the compulsion to make sure everything is correct because of the OCD. Sensation like breathing or swallowing. It affects our breathing, it affects our swallowing because it depends on what kind of symptoms or triggers that you are experiencing at that moment to trigger the OCD. So the triggers usually make our OCDs become active, where we have that compulsion to get rid of that trigger. So we constantly cleaning our bodies, cleaning our areas, or behaving in a way that we're not supposed to behave because we're trying to get away from that feeling. OCD is more common on people who are pregnant and postpartum, after having a baby. And that's because this is something new to them. And they want to make sure everything goes correctly. So they become very obsessive about getting everything right for the baby. So by them becoming obsessive, it will develop an impulsivity to make sure everything is done in the right way. Some studies have indicated about 20 to 42% of women experience worsening OCD symptoms in the week before their periods. Because remember, our hormones are changing. And when our hormones change, it makes our bodies fluctuate in all different directions. We become very emotional. We become depressed. We don't know what to do with ourselves. We cry. We become agitated. That's because our hormones has fluctuated in order for our bodies to bring our menstrual down. So our bodies are constantly changing. So that creates OCD and impulsive behaviors because we're trying to control these symptoms that we are getting before our periods. So we come up with all kinds of ways on how to control these symptoms. And these symptoms are so overbearing to us because it actually changes our whole well-being as an individual when it comes to time for our menstruals or giving birth or death or anything in general. So we come up with ways on how to create and how to minimize these symptoms. So we come up with impulsive behaviors on how to control these different symptoms that we are going through. So we're gonna leave it here right now, and I'm gonna pass it to Amanda.
Thank you, Ms. Greer. And I just want to just briefly tell you about the two major ways in which healthcare providers, address and treat OCD. One is through psychotherapy, which is also known as talk therapy, and the other is through medication, specifically antidepressants. So next week I want to talk more on the medication piece and also alternative treatments that you can use yourself. So real quick, psychotherapy or talk therapy, the driving force is to help the person suffering from OCD to face their fears and their obsessive thoughts, to acknowledge them, and to try to have these thoughts without using the compulsions to pacify them. Meaning, the obsessive thoughts always trigger the behavior. So the primary goal is to first acknowledge these thoughts, and gradually you will control, minimize, and then eliminate the thoughts. But in the meantime, you want to at least disrupt the trigger's effect, so that even if you have the obsessive thoughts, you do not automatically indulge in these compulsive behaviors. So there are two main types of psychotherapy. One is CBT, which is also cognitive behavioral therapy, and the other one is ERP, which is exposure response prevention. So we are going to talk more about these therapies and give you different types of examples. And always our goal is to empower people to help themselves and the people that they love that suffer from these various disorders. So stay tuned. Please like and share our video. We thank you for your continued support, and please come again.
Thank you. Have a great day and a great week, everyone.
Bye-bye.
Bye-bye.